As we reported last week, new research published in the journal Lancet Global Health suggests the number of blind people worldwide is set to triple within the next 4 decades. Meanwhile, the World Health Organization's Vision 2020 global initiative, launched in 1999, aims to eliminate the main causes of all preventable and treatable blindness as a public health issue by the year 2020. Joining us live via phone to discuss this issue from Hayward's Health in the United Kingdom is Dominic Haslam, Director of Policy and Program Strategy, Sightsavers, an international charity fighting preventable blindness. Mr. Haslam, welcome to the program.
Thank you very much. Good to speak with you.
Let me have your reaction to this report published in the Lancet that the number of blindness will really increase by 2020.
Yeah, I mean, this is obviously a tragic prediction, particularly as so much of it is entirely preventable. So currently around 80% of blindness can be avoided with the right access to healthcare. And yet what this research shows us is that we're going to see an increase in cataract, which is the leading cause of blindness, an entirely preventable situation in most cases, which requires just a simple and relatively cheap procedure to reverse or prevent. We're also still dealing with trachoma, and this is a disease which belongs to the ancient world. You know, there's evidence in hieroglyphics going back to the earliest African civilizations of trachoma, and yet here we are in the 21st century, and we're still dealing with people who are going blind unnecessarily from conditions like cataract and trachoma.
Can you give us a sense of the situation in sub-Saharan Africa?
Yeah, so unfortunately we will expect the burden of blindness to grow within sub-Saharan Africa, and that's where organizations like Sightsavers are really focusing our efforts, working alongside health ministries, the World Health Organization, and also the International Agency for the Prevention of Blindness. But what we know is that 9 out of every 10 people currently who are blind are living in low and middle income countries. So it's really impacting on regions of the world like sub-Saharan Africa. And it's very much aligned to a denial of access to basic healthcare, which includes these eye health services. Really, it should be a priority. We know that the World Bank has shown that improving and preventing vision problems such as cataract and refractive error are amongst the most cost-effective health interventions that are available. So there are solutions there, but we really need to scale this work up quickly.
So we know that with Vision 2020, there is this goal to reduce preventable blindness. So what is the issue here? What are the progress that we have seen and remaining challenges?
Okay, so Vision 2020 is a partnership between the World Health Organization and the International Agency for the Prevention of Blindness. And really, over the last 10 years, it's demonstrated that investments in eye health work. More people would have been visually impaired if it wasn't for the efforts of this partnership. So in percentage terms, we're seeing a decline in prevalence. So a lower proportion of the population is going blind unnecessarily. However, that decrease is offset by an increase in the global population, and people are living longer in sub-Saharan Africa as well as other parts of the world. And that's as a result of other health and social changes. So we need to recognize that and plan for it. What we have is these highly cost-effective solutions, cataract surgery, the elimination of trachoma and river blindness, and those can bring accessible and affordable eye care to even the most disadvantaged communities, but we need to scale them up. So we need to encourage governments to increase domestic funding. We need to be investing in schemes that enable all their citizens to access eye health services. And we need to enhance health systems and make sure that even the most marginalized, so older people, children, women, and people with disabilities are able to access these services as well. Again, it's a real tragedy that around 2/3 of people who are blind from avoidable causes are women. That's because women aren't accessing these services. They aren't getting the information they need, and the services aren't accessible to them for a variety of reasons.
Okay.
So those are some of the areas we need to focus on.
All right, Mr. Haslam, we have to leave it there. Thank you so much for joining us.